Right now in the process where we are is we've talked with the Department of Health for licensing. We've got approval for them to turn this into a 16-bed, 30-day inpatient program, which we're currently in the work release center right now. We've also got approval from Department of Health to retrofit the recovery center out in Bremerton to be a 16-bed crisis triage center and a 16-bed detox center. Those would be separated. We'll build walls down the middle of the recovery center out there and it'll basically be two separate facilities. Out here, initially, what the plan would be is we would move, when we close down the recovery center, we want to close that completely down for the remodel so it's not disruptive. We would move the detox population and the 30-day inpatient population temporarily to this facility, the work release facility. At that point, as soon as the recovery center remodel was done, we would move the detox individuals back to the recovery center, leaving this as a 16-bed, 30-day inpatient center. For several years, actually since the early 2000s, there's been 3 major needs assessments done for behavioral health in Kitsap County. Every one of those has come forward that we need a crisis triage center. That would be for people that are experiencing a mental health crisis where they can go. Around there, several of them around the state. People usually stay an average that they might only be there for 10 or 12 hours to help get stabilized, or they could stay there up to 5 days. We've had that strongly from law enforcement, from the courts, from mental health providers, from families, from NAMI, from advocates, that this is a real strong need that we need. It's one thing that's lacking in our county. So.